Hello, everyone. Sorry I'm late. A little Zoom issue there. So why don't we get started today for today's Program and Grants Committee meeting? And why don't we start with introductions? And Tess, I'll start with you.
Hi everyone, I'm Tess Parks. I use she, her pronouns, and I am the policy director of MIRAP and appointed by the Attorney General.
Thank you. Brendan,
Brendan O'Neill with the Attorney General's Office.
Melissa, oh, oh, Liz.
I'm Liz Blackwell Moore, she, her pronouns, and I'm the director for Cumberland County Public Health.
Great. Amber.
Hi, my name is Amber. I'm an individual in long-term recovery, and I'm also an LADC CCS at an OTP in Presque Isle.
Thank you, Jamar.
Maura Williams, appointed by the President of the Senate. Glad to be here today with everyone.
Thank you, Todd.
Good afternoon, everyone. I'm Todd Brackett. I'm the sheriff in Lincoln County.
Chastity.
Everyone, Chastity Toole, Executive Director of the Recovery Council. And for folks that don't know, Pat Kimball will not be joining us today.
Thank you. Elizabeth.
Elizabeth Fortier, coordinator for the Maine Recovery Council.
Great. And I'm Joe Everett, the President and CEO of the Opportunity Alliance, and I'm the chair of the Program and Grants Committee and a council member, and good to see everyone. So why don't we, Chastity, I'm sorry, I just saw your text. So we were going to prioritize the agenda. We have a lot going on. But why don't we, is there any updates around contracts and funding, Chastity and team, that you want to share with the committee? It's kind of a standing agenda item.
There's a couple specific things that we wanted to bring up, and it's one, getting working on no cost extension policy, because that's coming up a lot. And if there's any specifics, if you want us to take a stab and bring it back, if everyone has feedback to put into it first. And before I go to the next one, I'll wait for feedback on that.
Well, I would love for you to take a stab at that.
So with that as well, one of the things Elizabeth and I were talking about, like, I'm sure the state has a policy, but we're not the state, and there's always a lot of feelings to try and make it a lot more low barrier. So are there any funders people have worked with that would be good for us to check in to see if they have a policy they'd share?
I don't have, I like offhand, I mean, I think you could reach out to some of the funders that exist, philanthropies. I mean, I've had many no cost extensions from the feds, and it's pretty easy. You just ask for, you say you want one, why, and what your new budget is. I mean, that's pretty simple, like simple information that you could ask for. I'm wondering if, well, so we have a MEHAF grant, but they give their money out front.
Like we do.
Like we do. So yeah, maybe asking them what they do might be, I just don't know. I haven't asked for one from them recently. Offhand, I don't know, but yeah. Anyway, I would just perhaps ask around and see. My inclination would be like, we should lean in to no cost extensions as much as possible, but with some information about like, what have been the barriers to spending the funding? How are you going to meet those barriers? Like with just like a basic set of questions and like what's the extension for the, in the budget?
With that in mind also, who is it going to come to? Like, is it going to come to program and grants to review? Is it just staff and we report back? Is it finance? Is it the full council?
I think there should be a threshold, Liz. What do you think? Like, I think they're not all no cost extensions are made evenly or equally. So I think if you could think
Totally.
about that, Chastity, what you think gets escalated to this committee, I don't know unless it's really a big deal that it has to come to the full council. But if a project's really behind, then we would want to talk about it. But I think if it's, to Liz's point, kind of well explained.
Yeah, but and if it's like $1 million project and they've only spent $100,000, like yeah, that might be worth being like, what's happened to the other 900? What's going
Mhm.
on? And does the council? Yeah, I like that, Joe, of some sort of threshold that you all consider.
Mhm.
I just even don't even know what we're dealing with in terms of what people are asking for or what people have and have not spent. So it's hard.
And it's so across the board. Um, some I feel like people ask very early on because struggling to hire, like that seems like it's a regular theme. On a bigger level, this is going to come back to the full council soon, but we have one project that we funded. It started in June, almost $200,000. They've had trouble funding it. They've spent less or filling the position. They spent less than $5,000, and they've reached out to us and have asked, "What are your options? Can we transfer our contract to someone else? Like they want to just give their whole project to someone else." And so like there's a lot of different things. So that's where getting everyone's feedback of how you envision it before we start taking a stab at it. And FYI, we can't transfer a contract. We've
Uh-huh.
looked into that possibility to see of what it would even look like. And so yeah.
Well, I mean, that would be if we took it back, that's sort of a forfeiture, but we'd love to have that money. Can we use it differently per the conversation we're going to have today? So if they want to give it back, we'll gladly repurpose it if we had the capacity to do
Particular
it.
contract, well, they are looking into their options on their end. They are going to put together what they're asking of us, like whether they're going to do a sub agreement with someone else, whatnot. They're going to put it together. And so it'll come back to us to go to the full council to see what they're going to do because you guys will have to vote on that either way. So those are like the main pieces that we wanted because that second piece ended up rolling in here. So that was really all we wanted to prioritize in the contracts part today.
Great. So why don't we jump into I think kind of the meat and potatoes of today as the off-cycle emergency funding requests. And Chastity and Tess, I hope you're feeling better. Do you guys want to take it away and talk about what you've put together?
Sure. I'm happy to provide some context. I do have COVID right now, and I'm feeling pretty ill, mentally and physically, but this is really important to me, and I wanted to be here to mostly listen. So we've had conversations as a council and at different full council committee meetings around exploring a mechanism in which we could do off-cycle awards. And I'm not even sure if that's the correct term to call it off-cycle. But I had volunteered to come up with an outline or framework for emergent, urgent, um, off-cycle funding, recognizing meeting the reality of the moment where we've been and will continue to be. There are many organizations providing critical services to people who use drugs, people in recovery, their families, communities that are at risk of closing with federal funding cuts. So, what this draft and framework attempts to do is to come up with guidelines and a process where we would have the opportunity to potentially allocate funds based on criteria that we determine to attempt to prevent disruption in services, closures, and not as an end all, be all, ongoing, really one-time funding. And in the criteria that we'll talk about is looking to see if there's organizations that are also seeking out other sustainable sources of funding. So I've said enough. I just wanted to give that context, and I'm hoping that we can work through this as a group with the intention of I know finance had wanted to look at this as well, and I will stop talking.
And the committee has all seen this, correct, Tess? And right, Chastity, we sent this out.
Following Thursday's meeting, it gets sent out to everybody. The draft test put together and all stuff right here. And then for just like added context for the folks who weren't around before, the one that we attempted to do early on following the last grant award and never ended up like going through with.
So any feedback from the group on this policy and the work in general? Any thoughts? Go ahead, Todd.
I was just going to say is and with our conversation earlier, Joe, I just is it clear is that this policy is really focused on or would be focused on emergency type situations? When you say off cycle, the title throws me off a little bit, right? So I'm not sure what you mean by off cycle versus emergent. You know what I mean?
I would define off cycle as when there's no other funding opportunity that an organization or individual could apply to. And I used off cycle because that was really the only term that I could come up with, but I think if others feel like
I, I,
we use the title, we could do that.
and is this open ended or will this be focused on some sort of emergent situation?
There would be guidelines for determining whether or not you could apply. So you would need an urgent and documented need, evidence of immediate or imminent service disruption. There's examples of qualifying disruptions. You would need to show a direct impact on affected individuals or communities, and you would need to show that this money would create an immediate and feasible response. And then in the application requirements, there's a series of things that would need to be submitted to demonstrate that, and that would be information that the full council would be able to review in making its decision.
Thanks, Tess. I don't have it in front of me and I can't see the full screen, so I apologize.
I'll re-email it right now, Todd.
Elizabeth, I think we can take down the policy since yeah, I think if she's that way we can see. So I guess just like diving in, and then Todd, I want to give you time to talk about your idea that you've been talking about for 3 years around kind of smaller grants. So to me, like all roads lead to capacity. Like so what we can do this, but I mean, Chastity, where are we at was sort of like even moving. So I think Todd has talked for years about, and not to put words in your mouth, Todd, and I want to give you time to talk about kind of the one-off idea that you've had for 3 years. This is kind of off cycle. Are they the same or could they be the same? And like do we feel like we have a cycle, really? Like, we've awarded what twice and then made some one-offs, but can we just maybe spend some time talking about can you lead us through that, Chastity? Kind of like where you see us, where we've been, where we're going, and like what capacity do we have to do this work?
One second while I send this to you all. Um, so I can kind of envision it is both. Like there could be tiers in the emergent one. Um, I also think we don't have a great structure to do small awards because if it's small, it's still the same size, like amount of work for everything else on the other end. Like, so I think we would have to look at things much differently to do the smaller awards and realize that nothing's ever going to be quick. The council meets once a month and needs to vote for all of those decisions. So those are like the biggest barriers I see. Like anyone who reaches out and gives us, like, asks us about stuff, that's always like the very hard truth that I include in it is like, hey, we don't have anything open, but we're trying to figure out how to do that. And it's not a quick process. So if it's something you need quickly, unfortunately, we're not it. So I think another part of that is the council looks at how to partner with someone. I know we've talked about that before and then didn't, but for like the small ones that people need quickly, that may be better. I don't know. There's different components to it.
Mm-hmm. Melissa.
I'm sorry, you have to look at the black box with MCA on it. My internet's not great, so that's better than not being able to hear me in my mind. I was just sort of comparing the prior policy that we'd looked at and this one, and I just want to make sure I understand some differences that I see in this. My read of the policy that you just offered to us, Tess, is that it would be open to anyone, not just the folks who had previously received a grant, which I think was a constraint on the prior policy that we were looking at. And it doesn't cover prevention. So those are just two things I looked at kind of quickly and just thinking about, I think Brendan offered some insight about like how we would receive under the prior policy proposal, how we would receive those requests and process them. And I just wonder if this has gone through a similar review or if we thought we would talk about this at program and grants and then get that additional layer of just making sure if we're implementing this, that we're following the right protocols in terms of process for the council. So just some questions, and you don't even have to have the answers, Tess, just some thoughts that came up to me.
Beth, I want to say something before you attempt to respond. This has had no review from anybody, like anywhere yet. This is the first pass of any review, any input, anything. Just so everyone already knows that. And with it, when people want it, I can share the feedback Pat sent as well. Though some of it you guys have already brought up. That last one, we went through a lot of phases in that last one. Like it started as it was going to be for urgent stuff. And then because we were coming off of that last grant application and award, then it changed like, hey, why are we asking people to send us this stuff when we have dozens of applications sitting there that they could be looked at again? So really, really different. And I think there's something here that we can work with, but it's going to go through, like, I don't expect this is going to be fixed, decided, and is the end result today, especially knowing how everything works. Like there's a lot of layers here, but this is a starting point.
Yeah, and Chastity, maybe before Tess jumps in, yeah, that's helpful. And I think what I'm thinking about is like how wide the universe of folks is for that, right? So to me, it felt like maybe there would be an opportunity to have sort of streamlined review of things if they were folks who had already put in a proposal to us, or they're folks that we had, I'm thinking about the SSPs, right? Like that they've already received funding. They need something to fill a critical gap right now. That seems like easier money to move out the door to folks because we've already sort of approved that funding as a council. It's a priority. We want to make sure it's sustained. So I think that's what I was just trying to wrap my arms around, is like how big we're opening up the universe of folks to be new applicants.
Go ahead, Liz.
Yeah, I mean, because we're not making decisions here, I guess I have like a couple thoughts and questions to just put out. I so appreciate you putting this together, Tess, and the thoughtfulness with which you've tried to figure out how to like have people like to really make it so that it's like solving a problem for folks who are in this like urgent moment, that we don't want to lose that service or thing that's happening that's really important. So I like really appreciate that and see the need and desire for it. A couple questions I have. I mean, same thing of like nothing moves quickly with us. So trying to solve urgent things in a system that's not urgently moving is like somewhat, I just see the trickiness there. A question, some thoughts I have are just about like, we came up originally with some priorities. One way I could envision if this got put out that we could feasibly have 20 people apply, in a week. And if we say that, council staff will, within 10 business days, will screen those applications and then put it on, it's possible we could spend every council meeting like reviewing and trying to go through these and determine which ones do we want to fund. I mean, I just think there's a lot of need, and I don't know how to like narrow the scope because it could be overwhelming, the amount. So if there's and wanting to keep it broad because like there are lots of needs. One thought is like, are there high priority areas that we already had determined are our priority areas that it could be limited to? And I also wonder if there's a way to limit the scope of the scale of funding that we would actually allocate at any given time. Like that it's for a smaller amount, nothing over, or like that the pool is a certain amount that like runs out. I don't know. It just feels like we may need some container, a larger container than is here. But I love this as like a beginning guidelines.
Mm-hmm.
So thank you for your work on it.
Jamar.
Thanks, Sir Joe. That was actually one of the things that had cropped up for me, was this, if we could create a threshold of folks that are coming up to seek this funding that is in between the cycles. That may be as little as 5,000, 10,000, but capping it at a certain amount. And I'm just wondering if that may possibly speed up the process. But then also, so number one is the threshold, the amount that's being asked, but then also placing in that ask or in that space a minimum of days that they could expect for a turnaround, whether a yes or no, such as 60 days. I don't know if that's lenient or not, but just trying to put a time frame on it so that they have an expectation. But then also to minimize the communications back and forth and to ensure that they have clarity when the ask is placed out there, just kind of like a one pager so that they could check all the boxes so that it mitigates or lessens the communications back and forth, which draws that time out even further from the initial request of the ask to that 60 day time limit. For example, that 60-day time limit.
Cass, did you want to add?
Yeah, I'm hearing from a few folks the concern around capacity and staff time with any type of review process. So I'm wondering if maybe Chastity or Elizabeth could talk about what type of time frame would be reasonable for you, or if you had any thoughts on that component of it.
For just initial review.
Yeah, like reviewing what we might require.
Honestly, I think that's tricky. Like there may be, like Liz said, we can get, especially when this is new, I think we can get a lot. And as things are happening, I think we can get a lot of them all at once. And it would take quite a bit of time to go through, request any information we think we might need, notice it till all you guys get the information to you, and then also add it to whatever the next meeting is when you guys meet monthly. Um, I think having like 60 days actually is good. And obviously, like, goal would always be sooner, but I don't want to tie us into a box either.
So I'm just thinking about like um how foundations operate. And I don't know if this is still the case at John T. Gorman, but they have their sort of once a year, I don't know if it's still basic needs, but I'm struggling with sort of our structure so that like I think we're at a point where we kind of need to sort of like work on that. Chastity, to your point. So if there's going to be like an annual sort of grant, we have $10 million we're going to appropriate. So then if that's the high bar, then what? So because we have to build capacity. Like there's no because these grants that we've already um, allocated, now you're managing all the kind of the process of that. So there's the reporting, there's no cost extension. So like, do you feel, Chastity, that what are your thoughts around sort of the process and um, how we can improve it? You know what I'm saying? I think it's a little bit all over the place. So like we're going to introduce this, but we don't really have it sort of totally the main awards sort of nailed down yet because there's just not enough capacity.
There's not, I feel like we're gonna dig into all of that more, like with other things that are happening right now. Like working with PCG on the prevention stuff, which is gonna come back to this group too. So we're going to be digging into some of that and then planning this retreat. So like we have all these other pieces to help figure out the capacity that I don't know that it would be figured out right here today.
Mhm.
Um, so I think we'll be like going in a good direction, but it's always going to come down to more staff and like everyone just has like their department, so to speak, instead of everyone does something of everything. And because everyone's just all over the place just to keep things going, right? Like there's no great process when you're just trying to keep things flying and not necessarily well. That was not great verbiage, so I hope you understand
No,
where I'm
no,
trying to go with
it's
that. A very simple thing though, like I don't want to have the word urgent put in a policy anywhere because I don't want to give unrealistic expectations.
Mhm. Brendan.
Thanks. And just as I put my hand up, I realized that doing so might derail contemplation of Chastity's responses and further discussion on that point. So I'm happy to pause if there are other responses to Chastity's point. I have a handful of things that I just wanted to mention that I was thinking about.
Go for it. Feel free to derail.
Well, just picking up on actually both Chastity's point and Joe, your point about Gorman, um, in terms of it, it, I would just to cut to the chase. I was wondering whether, and I don't remember from when this was reviewed in the past, whether there were examples of such sort of emergent or off-cycle policies with other grant-making entities, whether it's private foundations, philanthropy, or any of the other entities that receive settlement funds in the state. Do any of the subdivisions have the ability to respond to emergency situations or a process, and how does that in all of those cases, how does that process differ from the organization's normal process? And another source of comparison could be in other states with other similar entities to the council. The answer may be there isn't, but that seems like worth asking the question. And maybe it's already been asked, and I apologize if I'm behind on this. It also seems, in the same vein, it seems like this presents a good opportunity because we're hearing, it sounds like, from organizations about the need for emergency funding. This is an opportunity, I think, to have this conversation with the other entities in Maine that are receiving settlement funds. To the extent that the subdivisions, have an opportunity, like if somebody comes to the council and says we need emergency funding, and for all of our reasons we don't have the ability to quickly help them out, it would seem to make sense to point them to the relevant county, city, or town. But I also wonder whether it makes sense to just have a larger conversation with the subdivisions, the 39, to say, we're getting these questions. Does it make sense is it possible? Is there some coordination that we could all do around, emergency funding? One, just I'm going to tick through the things I thought of. One of the things that I thought of just reading the policy is how to address, and Jamar raised this in the last meeting, how to address emergencies that arise due to issues within the organization or financial management in terms of any shortcomings that they may have due to capacity or expertise or experience. It's in reading through the application requirements, it does seem like that's contemplated, that there's a way for that to be fleshed out so that the council isn't so that the council is making sure that its money goes to organizations that are actually able to use it. But it kind of raises again the question of technical assistance, and whether or not an organization's problem is its own making. One of the requirements seem to, and I just want to say this out loud, seem to contemplate requiring evidence of a specific identified and obtainable solution that the money can be used for. For example, if people are losing staff, coming to the council to ask for money for staff that they aren't able to then find doesn't seem like a workable solution. So I think, requiring that, but that would probably be a requirement of the council's application process, anyway, not necessarily just this one. I also wonder whether the council would benefit, to the extent that somebody's coming to the council and saying, we have a documented public health emergency in our location and we need help. Does the council have somebody can turn to evaluate, the extent to which there really is a public health emergency and what the scope of it is and what the, real issue is. Um, and then finally, sort of getting back to capacity under application requirements, I think these are good and helpful. It seems, it, you know, I have a bit of sort of like it seems to me looking at numbers 4 through 6, evaluating the work plan and timeline, evaluating the budget, evaluating sustainability. It strikes me that that's a pretty big burden to put on the council or the council staff, depending on who's going to be doing the review or evaluation. And I wonder whether the council has both the capacity and the expertise to evaluate these. And, just evaluating those issues seems like it'll take up a lot of the council's time. So I'm not offering solutions, and I apologize for that. But I just wanted to further just add things to the discussion. Thank you.
Thank you, Brendan.
Todd, before you go, yes, whatever the proposal was you put together, send it to me and we will share ahead of the next meeting or whenever it's going on the agenda for people to review and discuss.
Will do. Thank you.
And
Thank
sorry,
you.
Todd. Yes, I'll make sure
No,
that
no,
happens too.
no worries. I just I have another commitment I can't put off. That's all.
Okay, thanks.
Um, while Brendan was talking, one thing came to mind that goes back to what Melissa said earlier. If it is someone we already fund, in those instances, much quicker because we can do amendments, and that is a lot quicker.
So Liz shared NEHAF's discretionary grant program information, and to me, that's a perfect way to describe it. And I
Yeah.
think that, like, go ahead, Liz.
No. You go. You go. I'm sorry.
No,
thought
I did.
Yep.
I think when you share that, Liz, like it speaks to the reality of our work that like we have to have this in place. NEHAF gives big, significant grant awards, but then they have this other amount, and John T. Gorman has a version of that. So I think thanks for sharing that. And I think that's probably gonna have to be our aspiration is to sort of get to that because there are parameters around that. Just reading it quickly.
Yeah, and Bingham has one too, discretionary. That one, theirs is 5,000. This one is 10,000. They're small. They're small. It's not for like really large things. It's for small things or small amounts, but are called discretionary grants. And so, coming up with some sort of guidelines of what that means, what's discretionary when there's 15 people making choices is a little tougher than, when Bingham, it's one person using their discretion. So it may be challenging, but it may also be something to aspire to as we're working through like other processes that we're trying to put in place to make our systems work better.
Mm-hmm. Definitely. And Brendan, you made some excellent points, and I think that, to your point about like a staffing situation, there are just things that we've got to be really mindful of sustainability and like sort of the ability to keep a program or an organization going can't hinge on our very, as the world goes, time limited time. We're not making a 10-year investment. So I think, that's got to be really important too, in our deliberation. But I am kind of stuck, and I'm just going to name it. I think we have some continuous quality improvement work to do. Like I think we have limited capacity, and I think Chastity and Elizabeth, it makes it even harder when it's all a little bit all over the place, to sort of like nail this down. And look, can you just speak again for the benefit of the people listening, Chastity, of like what our the new group the word I was missed the meeting, but our new grants management firm will help us with?
Um, yeah, so two separate things. So PCG is who we are negotiating a contract with for the grant management side of things. We meet with them tomorrow morning for that. So hopefully when we meet next month, we have more information to start moving that. And that will help on the administrative side of the 60 contracts that the council has. And we'll hopefully have some software that we'll be able to use, which will help tremendously. Separately from that, what I mentioned earlier, PC, no, HRIA that we're working with for the prevention stuff, they're helping to redo the grant application process for our next prevention, the coalition awards. And we'll do interviews with people, former council members, current council members, people who applied, didn't apply, other foundations to help nail that down more and take into consideration all the barriers that we have, doing everything publicly. So timelines change and like all of it. So I think that part is going to inform this piece a lot more for us. And they want to be on the agenda at next month's meeting, Joe. So
Perfect.
they'll be able to come talk about that. So two separate things. HRIA is the sooner piece that we'll be able to learn more to help figure this piece out with us. Tandem things, very different directions.
Good. That's good. So this sort of all feels like it goes together. So in terms of takeaways from today's meeting and with this work, um, Chassie, how do you see this fitting together with that work and what do you need from us? Except 5 more people.
Uh, without seeing what Todd's policy is, it's also going at this. Does what he wants to talk about from that, does that also wrap into all this, or is this something completely separate? Like, are we
No,
looking broadly at off-cycle funding, or are we going to do separate small pieces and then a separate bigger piece?
so I think Todd's work, and he's been asking for 3 years to sort of talk about this, this small one-offs, my word. But I do think it wraps together. And when we think of discretionary funding, to me, there's like it's the big grant cycle, and then there's discretionary. And Liz, do they do that all year long, or is it just a one and done, or do a lot of the foundations do it throughout the year?
I believe Mehas is like on a rolling basis. And I
Yeah.
know, I think Bingham's is the same.
Which would be ideal, knowing the needs that we have, but it also we have to have capacity to do that.
And Maine Community Foundation does, smaller grant cycles all year round that are like specific for different
Mhm.
things, but they're smaller grants of like, up to $10,000, I think.
So yeah, Chastity, I think it would be maybe 2 buckets.
But I'm
Yeah.
also wondering too if this is a conversation that will happen in our strategic planning of how, I mean, I think this is like a
Yeah.
great thing to have.
Yeah.
And I wonder if it's a part of our conversation about what do we envision and it looking like for the future. And that here's one thing we would like to do, potentially do, is have something like this. What's the
Mhm.
structure by
Right.
which, what do we need structurally in place to be able to do something like this? And have kind of these discretionary rolling I think it's like they go together, these conversations about capacity and like our structure and these smaller off cycle
Mhm.
grants.
Thank
I
you.
agree.
Yeah. With all the different pieces, I think that is, I think when it comes time for the strategic planning, like we can pull different stuff together, like have the different other policies for people to see and like get things together to be able to refer to. So we're not just starting over from scratch all over again.
Yeah. Yeah. MEHAV has 11 staff. Thank you, Brendan. And John T. Gorman probably has on par with that now.
Uh, Also worth noting, finance is also going to be looking at this. So they may be adding their own questions and feedback into all of this as well. And one thing we didn't talk about that goes into things is um, allotment and what we set aside for funding and emergent funding. Like will actually have to be thought about a little bit ahead for the allotment purpose because we get to meet with finance in April to figure that out for the next fiscal year.
Yeah.
Let me just follow up oh, sorry, Tess. Don't mean to jump ahead of you.
You can go ahead, Brennan. I'd like to listen.
Well, if I'm going to send a seemingly flip comment in the comments about the number of staff, I just like it's also worth pointing out that the council is bringing in vendors to fill in where other organizations might have, permanent staff. And that's, a totally valid way to, you know, peel the same orange. Um, it reminded me of a conversation that I had, and maybe others, I can't remember if anyone else was present for this, way back at the very outset of setting up the council with Efficiency Maine, to which I've sometimes looked as a potential analog to the council. Um, and my very limited snippet of what I recall from our conversation was I think that when they were starting out, they also took a kind of vendor approach. And their advice to me at the time, if I recall it correctly, was along the lines of be careful, putting like, overpaying for vendor support when you could, develop in-house, more long-term, cost-effective, building experience with in-house staff and support. Now, I haven't looked at Efficiency Main's budget, and it's a grant making entity, but it's a trust, and presumably it's meant to not pay out all of its money over, so it may, but long story short, like maybe worth it for the council to reach out to me, to reach out to Efficiency Maine to, sort of talk about these things in addition to the organization that um, we're going to consult with.
Thank you, Brendan. Really important. So Chastity, we don't have dates yet, right, up for that. But next month we're going. So let's move out of this into sort of a couple of just clean up agenda items. One was harm reduction, and I think Chastity, we put that on there in the fall due to the SSPs and things, but I think that's all been anything you want to say about that, those grants and such. I think we get that all straightened out.
Okay. Well, that's what I was texting about because I
Yeah.
didn't know why we had it on there without an explanation. Um, but yeah, that may have just been the carryover from
Yeah.
discussing that funding, which has been all reallocated, the 225,000, the amendments and new contracts from that have all been done.
Yeah. And then the other agenda item, which we began chewing on in the summer, was just needs assessment review. And I kind of think we need to pause that till we get through the strategic planning process. And just like we know what's going on. So like I think we need to be in action. So like it sounds like that, Chastity, that retreat and such will get us moving in the right direction, perhaps. And then we can come back to that conversation. Does that make sense? Because there's so much data we were talking about, the our inability to sift through like needs assessments and data.
Yeah. I'll let Liz go first, so
Go ahead, Liz. But you're
unmute
mute.
yourself, Liz.
Oh boy, sorry.
I know we all do it.
I actually have been having some thoughts about this. And so you all, and thinking about Brendan, I don't want to derail, but I have been thinking about this a little bit about how the strategic planning session seems like it's going to be like focused on our structure and our processes, and perhaps might not necessarily get to what are the next priorities that we want to do to fund stuff. And I guess I'm wondering, I've heard people say that they liked the process that we used for the prevention work group, and now we're using another work group for the school funding. I wonder if we want to consider having work groups on the other three topics that are basically doing small like assessments where you have a work group and you invite folks who are like, we have folks on our council who are willing to run work groups, and it may be, I feel like I'm not, this is, I'm not trying to my profession is doing assessments. Like that is what my profession is. I do assessments, I do strategic planning. Like I am like trained in that. And so it's been easy for me to do that, or not easy, but I like have the ability to do that. I know that not everybody, people in the council, their expertise is in not in assessments. It may be in actually like doing treatment or being a harm reduction provider, and so they may need support in doing like running a work group, but they do have expertise in like they could bring their expertise in the assessment part about like the content of the assessment. And so if there are folks on the council that be willing to be a part of and like lead a work group, I'm wondering if we could have 3 work groups that are starting to do and like come up with some recommendations. Essentially, it would be like assessments that are going outside of the council time, but bringing that back to the council. And perhaps we need some support on that. Like the work groups might need support. I had for the prevention, I had the New England PTC was my support, and they did it for free because it's what they do. And it's also my job every day, so it's easy for me to do. But I wonder if, the Moss Center is doing this kind of assessment support for other organizations across the state. They've been providing it. They have tools for it. And I wonder if we want to consider, this would be a Brendan question. So this is like I know this is not going to get solved today, but I'm putting it out there for us to chew on, because I do wonder if we could talk about whether we would want, if people like this idea, going under, essentially doing a no bid contract with Moss Center to support those work groups to do assessment. Because I'm slightly worried that if we wait till after March to start assessments, or April, we aren't going to have them done in time to be done with the rounds of funding that we have. And we want to have a next cycle out, but we won't have a cycle unless we know what we're funding and what our priorities are. So I just threw a ton at you, but it was like it's a thing that it's been churning on, and it feels like a possible way of starting assessments without having it be like whole council group doing it.
Liz, can I ask a question for clarity? Can you just briefly I think I'm not following. What are the 3 groups that you're proposing? Is it our needs assessment? That's what or is it assessing already done?
Yeah, I was thinking that it would be like having a harm reduction group, a treatment group, and a recovery group that has like a work group, kind of like the prevention work group, where we invite people from across the state that represent perhaps geography, particular demographies, particular groups that are high priority groups that then could do the work. I mean, essentially that's what the prevention work group did, is we did an assessment and we looked at what's already being funded. We looked at where are their needs, and then we recommended to the group what we thought should be their priorities. And I think we all did that work kind of together. We tried to do it together. And I guess I'm suggesting maybe we should tap into this wealth of groups across the state to do that kind of assessment for our next round of funding. And that using the Moss Center in this way, they're collecting all this information about what everybody's funding across the subdivisions, and they know what's happening at the state level and could be like support those groups to bring forth some of the information to help sift through what's already being done to help with those assessments. Does that make sense? Is that good? Am I clear now? Okay.
Liz, I
And
really,
Liz,
really, really like that. Go ahead, Brendan. Sorry.
sorry, Joe. Would they be, would, the Moss Center does have the ability, and is making this available to the public, what everybody else is doing and what all is being funded, at least with the settlement funds. And they, I'm sure, would have the capacity to be able to identify what's happening with state funds and with federal funds and so on. But that's like what's being funded. Do you feel like they would have the capacity to identify what needs are, as far as like what is the data show about what the problem is and where it is and things like that?
Well, I guess I don't know the answer to that question. And I think that's why you bring in other folks from across the state who are doing the work, who could speak to what they think are some of those needs. Because even you need qualitative data combined with that quantitative data to figure out what, and perhaps they could be helpful with that. I don't know the answer to that question. But it would be a both and.
I was just thinking, are there any other groups or organizations that are already doing both quantitative and qualitative analyses on the needs around substance use, opioid use disorder, maternal health, prevention, any of the areas that fall within the MOU? Like thinking in terms of, like would we be reinventing something that's already going to be taking place?
Well, I think like prevention, there's like a prevention strategic plan that the state has, but I think in this case, because we aren't just like wholesale taking what they like, I mean, Gordon has done a strategic plan of what he thinks the state says that should be done around all sorts of things. And I think it's like taking that information and matching it with what are other people funding, what do other people think. I mean, one of the questions we asked a big leading question we asked in the prevention work group was, what is the, also now given priorities, say there's 10 priorities, which priority is best suited for this funding? Because this funding is not forever. It helps people, like perhaps it's used to help bring up capacity to then do other things. Like, I think there's that big question that no one's asking but us. We're the only ones who will ask that question. And we can do this kind of assessment with all of us. And I just see how hard and long and slow that process is. And I guess I'm just suggesting if we had others to tap into and then bring it to the larger group in like a kind of recommendations format, it would be easy for all of us to take it in and like ask questions about it, or approve it as the next round of priorities, or make adjustments. It's like we're working from something.
That I really like this, Liz. That it makes so much sense to me, and it'll actually get done well. And the Moss Center has so much intel as it is. So, um, do we want to bring that, Chassie? How would you like that idea to go forward?
Elizabeth and I already met with them, obviously not about that specifically, about like some evaluation stuff and how they could help support us through some of this. So they were going to put a proposal together for us to review and see if we wanted to collaborate. So, I mean, we could ask them to also include a proposal for this for everyone to review.
Well, and as much as I love that idea, I do wonder, Joe, about like getting feedback from the larger group. I don't want to slow it down, but I also don't want to like just, on a whim make. I like what do other people think too, like Amber or Jamar or Melissa, Tess. Like, do you like this idea of these of work groups that we're doing this kind of assessment work?
I mean, Liz, this is Melissa. I'll speak for myself. I'm a huge fan of the work group process that we've had. And I do think I like the suggestion of creating similar work groups across other priorities. I think it creates, I'm just going to reiterate some of what you said that resonated with me. It creates connectivity with community members and experts in these different topics, which we may or may not have expertise on the council for. And I think it creates a more inclusive process for people to be part of helping us understand the landscape and what recommendations are coming to the council. So I found them to be really beneficial in terms of having that sort of like collaboration with folks that are outside and in the community outside of the Recovery Council. And I think it gets at that qualitative and quantitative opportunity to understand the landscape in Maine. So yeah, I think that they've been, it's been really helpful work so far. And I would support creating that as sort of a pattern across priorities. I just want to be clear that I'm not offering myself to lead all of those work groups. I just think it's a good idea.
I really like the idea of partnering with Moss, with all of the information that they're going to be receiving from the subdivisions and the dashboard that they'll be creating. I'm suspecting will have information, what percentage of funding is going towards treatment, prevention, MOUD, and in carceral settings. And that's going to give, because I think to kind of just jump back to something that came up in the off-cycle grant conversation of, well, how do we know that we can't just refer them to their local county commissioners or city? I think we're going to get more information of what those funding opportunities are available. I'm not I think I'm in favor of doing work groups to really understand the need, but also looking at capacity. And I'll just be honest where I'm at. My focus is that organizations are on the verge of closing. And I think there are needs that we know exist. So I understand that a lot of this is limited by our processes and we talk about capacity. And I think that where I'm coming from, I'm hoping that one of our priorities at our retreat is coming at I've heard so many counselors say emergency funding is important to me, a strong majority. If it's truly a priority and something that we value, then maybe that's something that we need to have a work group on. Because I agree, we should be studying the need, but I think to me it feels tone deaf when we know there are urgent needs that we currently don't have the capacity to respond.
Mhm. So just in terms of moving this, like I have no problem, Liz, like as part of my report at the council meeting, raising this and we can have a conversation. So Chastity, does that sound like a good, I think it's kind of low hanging fruit to me if we could move this. If Chastity, if you are having conversations with the Moss Center, it might be, let's just move it.
Yeah, that's fine. I just want to say one thing on it. I love the work groups, like have not knowing as much about prevention. I loved having a presentation that told me like this is what we need and would love them for all of the pillars. And I'm really worried about that people won't step up to do it. So I like it, and I have concern on it that there'll just be no one to lead it.
Chastity, if I can just say something to that, I think um, our shared responsibility on the council is to name what we think might be helpful and then to have those be offers for folks to step forward. And if folks don't step forward, there's only so much to be done about that. But I think just supporting the conversation and the opportunity and then see where it goes. And if people don't step up, they don't step up. And I don't say that blithely because folks are stretched thin, right? But I think just being able to name the opportunity and then seeing what folks choose to do with it.
And I do think if we were to think about getting the Moss Center support on it, I think it could be really clearly outlined. And I could be, I think I'm not signing you up, Melissa, but I think Melissa and I could come up with like, what is the core outline of a work group? What are like some core functions of that? And what are like the roles of, I think this newest school funding work group is the clearest version of like what a staff, or I mean a council member, because like I don't know the content very well of that. Like there are the experts. It was about like but I know people, right? So it was like coming up with like, who do we think are the people who could do this? And Melissa and I had to have a conversation, public one, where we came up with who are the people that could provide us with the information. And then having the Moss Center be able to support folks, like in making that clear. I think we would have to like make that clear that they would get support. So it might not be Moss if it's somebody else, but that you would get support to do it. And to your point, Tess, I do think the point of this is not, I think these are like parallel lines here. There's emergent funds, and then there's like, how do we get ourselves set up to fund a large round next time? And for me, this is like, I guess I'm talking about this work group as being like not necessarily like it could be needs talks, but it's also like, what should we fund? What are our priorities for funding large amounts for the future? And what comes up in emergent needs will be a part of that, but it'll also be like other things. So I guess I see them as parallel tracks, and I hear you. And I see them as parallel. And I don't want this to go far away where like if we say we give out $10,000 awards, but people really need 200,000 or 700,000 and they have no mechanism to do that, that would suck too. So that's why I don't want this to get in the way of what you're talking about, but I see them as parallel.
Yeah, no, Liz, and I hope I'm not coming off as, argumentative. I think I'm just frustrated, truthfully. I recognize that they're parallel and they both need to be done. I think it's just challenging when in my professional role, and I'm someone that did 33 listening sessions 2 summers ago. We'll go into this summer, we'll do 20 to 30 listening sessions, we'll go into communities, we'll hear what the needs are. And I think my frustration is that a lot of those organizations that we hear from, and we know many of these services in service deserts, like the Recovery Community Center. I know I keep bringing that up. That is like the recovery service for miles and miles and miles. So I think for me, I'm just the sometimes it feels like, and I think Sheriff Brackett had mentioned this at our last full council meeting. It's like having that moment of, I wish we had the capacity to move quicker when there's the need is so great. But I hear you, Liz, I do. And I think, honestly, I think the funding landscape is going to be changing so much that we are going to want to have those work groups, whatever that looks like, because what is available today might not be what's available in 6 months, and the needs are probably going to be changing.
Well, and I see then a place for all those listening to sessions that all that work you've done with themes. There's a place for that to like, we could do that here, but if we're doing that here times 3, right? For like recovery, harm reduction, and treatment, I think it'll just take us too long to get through it. But that could be a place where that information that you've collected that's related to those three different topics is a place to go, and then it's usable to us. Of like, yeah, maybe all of our recovery money we've set aside should go towards supporting recovery centers, and that's the priority. I don't know. I'm just like saying that out loud, but
I think our listening session report is a tool. It's not an end all be all. There's not a lot of
exactly.
quantitative work. I mean, our model is we listen, and that's how we come up with our legislative platform. And we've shared the 2024 report with the council, and what we hear in 2026 will absolutely be public and shared and can be used as a way to help garner more information about the needs, barriers, and challenges communities are facing.
Okay, so let's any other business, then we can move into sort of planning for the next. So Chastity, you and I may need to chat to sort of work on the next agenda. So I know this needs to continue. We have guest speakers at the next meeting. We can talk about Moss at the full council meeting in January. And that's probably the agenda for next month. And then we will likely know more about dates and such for the strategic planning session or sessions.
Yeah,
Yes.
we hopefully should. But yeah, if you want to set up time out any time before the next meeting, we can
Yeah.
meet and iron out whatever. So this meeting, we've only been having this for an hour. This meeting, since it was 2 months, I like changed it on everyone's calendar kind of slyly and put it an hour and a half and didn't tell anyone I did that. I just did it. Do you guys want to go back to an hour? Put it an hour and a half, and if you only use an hour, like, what do you want to do going forward as we iron out all of this?
I think our goal should be an hour, but we can allot an hour and a half. I think people are really busy, so I think we want to try to, but I think there's times it's going to go over. So if people can hold an hour and a half, then we can shoot to be finished by an hour.
Okay.
I'm gonna agree with Joe as well with that, having an hour and a half, so we have that flexibility there just in case. And also, there's just a FYI that having the separate work groups that allow us to get further faster without all of us collectively in the room. And so I'm always in agreement of getting to a space faster without it consuming everyone's time here and allowing us to make more uh, make decisions based on real-time information.
Well said. Okay, on that note, I think we're gonna wrap it up. And thank you, everyone. Good conversation. I hope everyone has a bit of a rest throughout the rest of this month, maybe, and we'll reconvene in January. Bye-bye.
Hi,
Have a
everyone.
nice holiday, everyone.
Thanks, everyone. Happy holidays.